Goals of asthma management. You want to avoid exacerbation. You want to avoid keep having these attacks of asthma. You want to avoid the allergens. If we can identify what they're allergic to, we can stay away from it. Relieve asthmatic episodes promptly. Relieve the bronchospasms. Monitor the function with peak flow meter. Self-management of inhalers, devices, and activity regulation. It's a chronic situation. So with a child goes past being a young child and they still have their asthma, we send these teenagers and we send, adolescent children away to camps. They learn to be with other children that are just like them so that they know that they're not the only one in the world that has it. They learn independence from their parents who are very overprotective or that always want to do for them. And they learn how to really take care of their illness. It's a wonderful, wonderful thing that these camps accomplish. They do it for diabetic children, they do it for asthmatic children, they do it for children with chronic illnesses. And it's the best thing that can happen to them because this is something they're going to have to learn to manage and take care of the rest of their life. Cystic fibrosis. Exocrine gland dysfunction that produces multi-system involvement. Most common lethal genetic illness among Caesarean children, or Caucasian children, excuse me, Caucasian children. Approximately 3% of the U.S. Caucasian population are symptom-free carriers. It's an autosomal recessive trait. What does that mean? Inherits defective gene from both parents with an overall incidence of 1 in 4. Characterized by several unrelated clinical features, increased in sweat electrolytes, thick mucus gland secretions. Primary factor is thick mucus which obstructs their breathing. Earliest postnatal manifestation is meconium ileus, a thick plug of meconium which obstructs the intestines. If they see this, they pretty much suspect cystic fibrosis. Increased viscosity of the mucus gland secretion results in mechanical obstruction, thick mucoprotein accumulates, it dilates, precipitates, coagulates to form secretions in the glands and ducts. Respiratory tract and pancreas are predominantly affected. It just clogs everything up. If you'd see what these children bring up after they've received their breathing treatment and their chest percussions and all, it a lot of times it just looks like pudding. Increased sweat electrolytes. Basis for the most reliable diagnostic test is sweat chloride test. We had a baby in the NICU, and the baby smelled salty. You could tell that this baby just sweat profusely and smelled salty. And when we put our finger on the little baby's arm and tasted it, it was very, very salty. And it was, they said, oh, well, we can't diagnose. But it turned up this child was putting that much sweat out that was salty, that yes, the baby was diagnosed as a preemie. Sodium chloride will be 2 to 5 times greater than in the controls. Other factors: increased organic enzymatic constituents of saliva, the abnormalities of the autonomic nervous system. Present in almost all CF patients, but onset and extent are variable. Stagnation of mucus and bacterial colonization result in destruction of lung tissue. Tenacious secretions are difficult to expectorate, obstruct the bronchi and bronchioles. These children used to die very early in life, and now I think, I don't know if I read it or what, it was a child that reached like 30, 35 years old, and that's just unheard of. These children go through an awful lot of respiratory therapy to stay disease-free and to reach that age. Decreased O2 and CO2 exchange results in hypoxia, hypercapnia. What's hypercapnia? Acidosis, compression of pulmonary blood vessels, and progressive lung dysfunction lead to pulmonary hypertension, cor pulmonale, what is that? Respiratory failure, and death. Infectious pathogens. I am not going to sit here and struggle through all these pronunciations. Klebsiella pneumoniae, Escherichia coli, Haemophilus influenza, Staphylococcus aureus, Burkholderia, Capacia, and Pseudomonas aeruginosa. Respiratory progression. Gradual regression follows chronic infection. The bronchiole and the epithelium is destroyed. And as you destroy little pieces of this, that means they become very elastic and fibrous and they don't recover and recoil like good lung tissue. Infection spreads to peribronchial tissues, weakening bronchial walls. Peribronchial fibrosis, that means they become fibrous, and decreased O2 and CO2 exchange. Chronic hypoxia causes contraction and hypertrophy of muscle fibers in the pulmonary arteries and arterioles. Pulmonary hypertension, cor pulmonale, pneumothorax, and hemoptysis. What is hemoptysis? GI tract. These sick secretions block the ducts. Cystic dilation, degeneration, and diffuse fibrosis. Prevents pancreatic enzymes from reaching the duodenum. This is where it clogs up the pancreas. Impaired digestion and absorption of fat, which is the steatorrhea. Impaired digestion and absorption of protein, azoturia. So they don't do well with their fats, they don't do well with their proteins, because it's all clogged up. Endocrine function of the pancreas initially stays unchanged. Eventually, the pancreatic fibrosis occurs, may result in diabetes mellitus. Focal biliary obstruction results in multitubular biliary cirrhosis. Impaired salivation. Pancreatic enzyme deficiency, progressive chronic obstructive pulmonary disease associated with infection. Sweat gland dysfunction, failure to thrive. A lot of these children, because it takes so much work and so many calories to keep breathing and keep this body going, they do look underfed. They look very, very like failure to thrive kids. Increased weight loss despite increased appetite, and gradual respiratory deterioration. Endocrine function of the pancreas initially... Infant and child CPR videos. These two videos, this video is really a good video. Put it up in your URL and look at it. It's a good video to see. The guy does a nice job on it. And this is something that anybody who has a child with a respiratory problem or any chronic illness should know, is how to do infant or child CPR. You'd never want your child to fall down in front of you and die because you didn't have these skills. Presentation with cystic fibrosis, the wheezing, respirations, dry, non-productive cough. This is how it starts out. Generalized obstruction, emphysema. Patchy atelectasis. What's atelectasis? Cyanosis, clubbing of fingers and toes, and repeated bronchitis and pneumonia. Meconium ileus. What's a meconium ileus? Distal intestinal obstructive syndrome, excretion of undigested food in the stool, increased bulk, frothy, and foul-smelling stools, wasting of tissues, prolapse of the rectum, delayed puberty in females, sterility in males. Parents report children taste salty. Dehydration, hyponatremic. What's hyponatremia? And hypochloremic alkalosis. Hypoalbuminemia. What's hypo? Quantitative sweat chloride test, chest x-ray, pulmonary function tests, stool fat and enzyme analysis, and a barium enema. Treatment: prevent or minimize pulmonary complications, adequate nutrition for growth, and assist in adapting to chronic illness. You use chest PT, bronchodilators, forced expiration, aggressive treatment of pulmonary infections, home IV antibiotic therapy, and these children know what antibiotics are because they take a lot of them. Aerosolized antibiotics. You want to prevent or minimize pulmonary complications, adequate nutrition for growth, assist in adapting to the chronic illness. Pneumothorax. What's a pneumothorax? Hemoptysis. What is that? Nasal polyps, steroid use with NSAIDs, and transplantation. Replacement of pancreatic enzymes. Go on a high protein, high calorie diet, as much as 150% of what your normal daily amount should be. Intestinal obstruction, reduction of rectal prolapse, and salt supplementation. These kids put out a lot of sodium. Estimated life expectancy with CF in 2003 was 40 to 50 years. I've not seen a whole lot of those. I've seen more of them make it to like 20s, 30s. And it depends on the support systems they have, the medical attention they receive. If you have a parent that isn't aggressive with this treatment, and it can really be bad. I mean, it could shorten your life considerably. Maximize health potential, nutrition, prevention and early aggressive treatment of infection, and pulmonary hygiene. We call it pulmonary toileting, and that's your chest physio and your breathing treatments and postural drainage. New research, hope for the future. They're thinking of gene therapy, bilateral lung transplants. Lung transplants, people usually don't last a whole long time. I know with the children that had pulmonary hypertension, 2 years from a set of lungs. And it's very, very painful They have a lot of pain, and they have a lot of problems with the anti-rejection drugs, and it's just not a great quality of life. I know a parent that said after the one lung transplant, she didn't want it anymore. She put him